All right, on today's call, I want to discuss effectively reversing diabetes without drugs, and that's type 2 diabetes is what we're talking about today. And we will look at research that shows that functional medicine trumps conventional medicine in type 2 diabetes care. And um, one thing I want to discuss is that the research is looking at lifestyle medicine, and the distinguishing factor between lifestyle medicine and functional medicine is really lifestyle medicine folds into functional medicine. Functional medicine is lifestyle medicine plus. Lifestyle medicine seeks to address things through, you guessed it, lifestyle, leveraging natural strategies such as nutrition, physical activity, stress reduction, social systems, things like that. It doesn't use supplementation typically. Functional medicine uses all those things, all the things included in lifestyle medicine, and adds in supplementation as well. And so some of these studies will be lifestyle medicine only, some of these studies will be supplement only, but all of it falls under functional medicine. And as is pretty intuitive, if you get results with lifestyle medicine only and you can get results with supplementation only, it would make sense that you would get even better results combining the two. And so let's dive into the evidence. And here are statistics from the American College of Lifestyle Medicine, and they basically took statistics from the CDC and made it look pretty on this chart. And essentially, chronic disease is what is destroying the US, it's what is bankrupting the US, and it's what is the main reason people go to the doctor. The problem is that the mainstream healthcare system is not built for chronic disease. It's built for acute disease, car wrecks, broken bones, heart attacks, acute life-threatening things. But what most people go to the doctor for is a chronic disease. As you can see here, 6 out of 10 Americans have a chronic disease. 40% of Americans have 2 or more chronic diseases. What are those? Those are things like heart disease, cancer, diabetes, stroke, Alzheimer's, autoimmune disease. 38% of Americans will be diagnosed with cancer during their lifetime. Cancer is a lifestyle disease. There is some genetic contribution, but the preponderances of cancer are lifestyle driven. Half of Americans have cardiovascular disease. 72% of Americans are overweight or obese, and 88 million Americans have prediabetes, and 90% of those 88 million don't know it. Okay. 34 million people have known type 2 diabetes. So we've got over 100 million people in the United States on the diabetes spectrum. And that's partially why the overweight and obesity numbers are so high. The two are interrelated, and then they contribute to cardiovascular disease and cancer. So we've got this giant vicious cycle of chronic disease, and it hasn't gotten any better no matter how many drugs pharmaceutical companies have come out with. Okay, so we're not going to solve chronic disease in general and diabetes specifically in the United States or anywhere in the world with medications. We need to nip it in the bud. We need to address the root cause, and that is lifestyle. And lifestyle consists of what's pretty intuitive: diet or nutrition, physical activity or the lack of it, but also toxicity. Toxicity is a major driver of type 2 diabetes. And then stress and sleep deprivation and other environmental and lifestyle factors. So is there any research looking at lifestyle for diabetes? Good question. Yes, there is. And we'll start with a study from 2002. Why 2002? That's not new. Well, exactly. That's my point. I don't want to show you a new study. I want to show you one from way back then. Over 20 years old, to let you know that, A, a functional or lifestyle approach has been investigated for over 20 years, and B, if that's true and it's been shown to work, well, why hasn't that been screamed from the rooftops? And the reason is natural strategies don't make money for pharmaceutical companies. So here we are, New England Journal of Medicine, one of the most well-known journals in the United States and possibly the world. The paper is entitled Reduction in the Incidence of Type 2 Diabetes with Lifestyle Intervention or Metformin. Excuse me. So as you can see from the title, there were two groups. One group was lifestyle intervention and one group was metformin treatment. And metformin is the medication that is most commonly given for type 2 diabetes. And so you can see in the highlights here that lifestyle intervention reduced the incidence of diabetes, type 2 diabetes, by 58% over the life of the study, compared to metformin reducing it 31%. The lifestyle intervention was significantly more effective than metformin. And so, again, all you hear is metformin, and when you're at the doctor and you're pre-diabetic or you're type 2 diabetic, you're only going to be told, hey, you need to take some metformin. They don't mention that 58% reduction occurred with lifestyle alone in type 2 diabetic patients, which was almost double the reduction compared to metformin. That's what they should lead with intensive nutrition, dietary change, physical activity change before ever putting you on a medication. So that's 2002. We've known that for a long time. Here's another study from 2010 comparing berberine, which is an herb, head-to-head with metformin for type 2 diabetes. And you can see in this clinical study, berberine significantly lowered fasting blood sugar, hemoglobin A1C, which is your average blood sugar over the last 90 days, triglycerides, and insulin levels in patients with type 2 diabetes. The fasting blood glucose and hemoglobin A1C lowering efficacies of berberine were similar to those of metformin. And in conclusion, we strongly suggest berberine as an ideal medicine for type 2 diabetes with a mechanism different from metformin. So here we have an herb that's been used for ages and ages in traditional Chinese medicine and for many decades, even in the West, that, again, head-to-head, and this is just one study, but there's many studies showing that berberine is equal to or better than metformin head-to-head for type 2 diabetes. There's many studies showing this. Why isn't berberine being used instead of the medication? Well, again, because of the finances involved in it. But for those of you who are out there and being a self-advocate and doing your own research and looking for natural strategies, berberine is an evidence-based strategy for type 2 diabetes or insulin resistance or anything along that insulin-resistant prediabetes type 2 diabetes spectrum. Moving forward, here's a study that, again, looked at lifestyle intervention for type 2 diabetes compared to the usual treatment of diabetes support and education, right? So rather than just saying, here's a handout about diabetes and blood sugar, one group got that handout and nothing else. The other group got intensive lifestyle intervention. And this was a 4-year study. So they took 4,500 adults with a BMI greater than 25. So those are people considered obese and also type 2 diabetic. Half got the lifestyle intervention, half got the diabetes handout. And at years 1 and 4, patients in the lifestyle group were compared to the standard diabetes group. The lifestyle group had greater weight loss. The lifestyle group had greater fitness, and they had a much higher likelihood of partial or complete remission of type 2 diabetes. At year 1, the lifestyle group had a 11.5% higher likelihood of complete remission compared to the standard treatment. And at year 4, it was a 7% increased likelihood compared to standard treatment. So again, lifestyle intervention trumps standard care for type 2 diabetes. Here's a 2020 study in the journal Diabetalgia. And this is looking at type 2 diabetes remission. And why is this important? Well, it's important for viewers to know that in medicine, or in healthcare, I should say, or in the health blogosphere, it's technically, you technically can't say you heal, cure, or fix anything unless you're using a medication. Pharmaceutical companies essentially have the exclusivity on using those words per the FDA. So I can't say I could cure your type 2 diabetes or heal your type 2 diabetes because I'm not using a drug. So, it's semantics, but it's helpful for you to know that because that's the game that's being played. But that makes this study even more important because here in a diabetes journal is a study looking at remission of type 2 diabetes, reversing or basically reversing or driving type 2 diabetes into remission with lifestyle. Okay, so with a non-drug strategy. So let's dive into it a little bit. Aims of this study: approximately 10% of total healthcare budgets worldwide are spent on treating diabetes and its complications. Say wow. 10% of healthcare budgets worldwide. So we're not even talking about the US anymore. We're talking about the entire world is focused on diabetes. All right. So if we could reverse diabetes or drive it into remission, that is a massive savings for governments, for countries, for individuals, in finances, but also obviously in quality of life and morbidity and mortality. So the aims of this study were to estimate the within trial and lifetime cost effectiveness of the weight management program, which achieved 46% remissions of type 2 diabetes at 1 year and 36% at 2 years. So this was a 2-year trial implementing lifestyle to see what can we do. Is it useful? Methods. So they used an intervention called the DIRECT program, which included training, program materials, practitioner appointments, and a low energy diet or a low carb diet, along with glucose lowering and antihypertensive medications, and all routine healthcare. Lifetime cost per quality adjusted life year was estimated according to projected durations of remissions, assuming continued relapse rates as seen in year 2. Conclusions: incorporating the lifetime healthcare cost savings due to periods of remission from diabetes and its complications, the direct intervention is predicted to be both more effective and cost saving in adults with type 2 diabetes compared with standard care. All right, so again, lifestyle is more effective and saves more money than standard care for type 2 diabetes. That's huge. And if you look at the box to the right, the first highlight says the intervention may be cost neutral within 6 years. So what they found in the study was initially the natural care, the lifestyle care, was cost more money in the first 2 years. Okay, but by year 5 or 6, you break even. And this isn't unexpected. You've probably had the conversation before, right? Functional medicine, some people say functional medicine is expensive. Well, compared to a $50 copay, it is, right? Most people would rather pay a $50 copay than a couple $1,000s up front. The difference is you can pay a $50 copay for 30 years and still end up having to pay $50,000 for chemotherapy. Whereas the thought with lifestyle or functional medicine, you might spend a couple $1,000s up front, but then you get yourself healthy. You're empowered with how you need to live to stay healthy. And then you're spending very little money relatively the rest of your life. So by year 5 or 6, that money you paid up front is now broken even with the same person who is paying $50 copays and is now paying for, surgeries or other things that cost a lot more. So it's the investment up front that leads to savings over time, better quality of life, compressed morbidity, all of those things. So this study provides strong evidence to support shifting diabetes resources to evidence-based programs that achieve remission, even if remission is maintained for a limited period. So that's important too, right? You saw that using this strategy, there was remission in 46% of patients at year 1 and 36% at year 2. Well, what happened? Well, 10% of those people who remitted in year 1 fell back or had a flare, say, in year 2. Well, the numbers show even if these, if the remission isn't kept forever, the cost savings is still massive to the system and to the person. So where functional medicine, or at least my office's focus, is we want you to get the remission in year 1 and then keep it forever, right? How can we get with these patients and keep them on task, keep them focused, keep them implementing the strategies that keep those gains so they don't fall off? And if they fall off, we catch it and we adjust, right? Because life happens. And so sometimes we need a redirect. But this is powerful. So let's look at a real example. So here's an example of a 49-year-old female with type 2 diabetes. She is currently in diabetic remission that has been maintained over time. So in January 3rd, 2020, she presented with a fasting blood sugar of 266 milligrams per deciliter. You'd like it to be, optimally around 80, 85. So her fasting blood sugar was very high, and that translated to a hemoglobin A1C of 10.9%. Optimal is about 5%. So her A1C is over double what it should be. Okay, so that is big time blood sugar dysregulation. Diabetes is diagnosed depending on the lab at either 6.3 or 6.5% or higher is considered diabetes. So she is robustly diabetic at a near 11%. So what do? We implement functional medicine, lifestyle medicine strategies. And at 3 months, her fasting blood sugar had dropped over half, down to 117, and her A1C to 5.7%, which is the first, on most labs, 5.7% is the first level that is lab high. Usually they have normal ranges of 4.5 to 5.6. So her 5.7, massively down from 10.9% and almost to normal range. At 17 months, her fasted blood sugar is 108 and her A1C is 5.4. 5.4 is within optimal range. And so she has totally, she's in diabetes remission. You could even say she reversed it because she, no longer fits it and hasn't fit it in over 17 months. So remission, remission is robust and sustained. The average diabetic patient pays $9,600 per year for healthcare involved in taking care of diabetes and its complications. So this patient, at January 3rd, 2020, since then, in 17 months, with the remission of the diabetes, has saved nearly $20,000. Okay. Projecting that out 25 years is a cost savings of almost $250,000. So we said earlier, people might say, hey, this kind of care is expensive. All right. Compared to what? If you're type 2 diabetic and you're paying you're an average type 2 diabetic, you're paying $9,600 per year in care. To spend that much on functional medicine in a year, I've never had anyone do that. So, expensive is relative. And when you get the numbers of what diabetes is costing individuals and governments and nations, implementing lifestyle medicine, functional medicine for a couple $1,000s early on is a no-brainer and an immediate savings. So if you want to learn more about how functional medicine could help you reverse your diabetes or drive it into remission, my YouTube channel has over 20 videos on diabetes in it, where you can learn a lot more and understand what may be driving symptoms in your case and see real patient cases and things of that nature. So I encourage you to go check out my YouTube channel, and the @Functional Medicine Charlotte handle is how you can get there. And just know that there are options out there other than metformin for you, other than a diabetes handout. You don't have to do this alone. There are lots of functional medicine clinicians out there that can help you implement the lifestyle strategies through nutrition, through physical activity and stress reduction and sleep hygiene and toxin avoidance and supplementation to help you drive your diabetes into remission and reach that life at optimal that you seek, so that you can be the best parent, spouse, co-worker, and you that you want to be.